Hi, I'm Clayton Barhorst. I'm a fourth-year medical student at Texas A&M, and I'd like to take a quick minute to talk to patients about things that they can do to help improve their health literacy, meaning help them better understand how to ask the questions they need to ask at the doctor's office and how to implement the doctor's plans for them and follow prescriptions and whatnot. Basically just to help them take more control over their own health. The first thing you can ask about is if you've gotten a new diagnosis, or if your doctor's talked to you about something that you don't quite understand enough, be sure to ask him for any other materials for patient education. A lot of companies make CDs or have websites that help better explain different procedures or different diagnoses. So be sure and ask about different media options. Secondly, I think it's important for patients to know that there are a number of other health professionals besides doctors who are out there to help patients improve their health. People like dietitians, physical therapists, or even if you're in the hospital setting, social workers. These are resources that are there for patients that patients should feel open and should know to ask their doctors about if they haven't already been informed about them. Thirdly, I'd like to just emphasize that if there's ever anything that a doctor says that a patient doesn't quite understand, especially regarding a diagnosis or a treatment plan, patients should just feel free to speak up and ask questions. Most doctors would encourage questions. Most doctors would be happy to explain anything that wasn't well understood. And then finally, for patients who perhaps don't have English as their primary language, anytime a language barrier exists and a patient's uncomfortable with that, they should feel free to ask for some sort of interpreter. A lot of hospitals have an interpreting service, whether that's translators or a phone service where you can call and have somebody translate what procedure is going to be done or what the doctor's plans are for the patient. So these are tips just to help patients improve their health literacy. You know, I was kind of shocked to find that there are over 90 million Americans who would qualify as having low health literacy, which makes an impression on me that I need to spend time with each patient and not assume that they know what I'm talking about, but rather explain to them in rather basic terms just because they haven't had the training I have, and just make sure that they understand their diagnosis and that they can best help themselves to improve and get better and maintain a good quality of life. Thank you very much. Bye.